And as law enforcement sifts through the aftermath of the mass shooting there in Orlando, of course, the area hospitals are in high gear. They're treating 53 people who were wounded in this horrible attack. Meantime, hundreds of people are lining up to donate blood. You've heard the cry out to please come down and donate blood, that would be very helpful because there they are in the trauma centers. Dr. Samadi is here. Dr. Mark Siegel's here. I think I want to start there with you, Doctor. I'll go with Dr. Samadi just because of you as a surgeon. What is happening in those surgery rooms there? Give us an idea.
So what really is happening is that you're getting a lot of triage calls from what's going on the ground, and the paramedics have a very critical role to find out and really tell us what kind of injuries we're looking for. Obviously, this is in a nightclub. You're talking about the gunshot wounds, which is done in a very short space of the nightclub, so you're looking at a very high velocity penetrating injury, so you could have a lot of vascular injuries, bowel injuries, and so we are waiting in the hospital in the entire trauma booth, and the backup team is are always there. The difference between our level 1 trauma hospital and regular hospital is that you have in-house 24-hour surgeons that are available, but the scope of this is way beyond any hospital that can take care of this. So you need a backup and a backup team to be there. Vascular surgeons are on the way, general surgeons are there, and everybody basically get them, triage them. Yeah. Obviously, blood products is absolutely vital because one of these cases, if they have gotten any of the iliac vessels, you may go through 30, 40 units of blood.
What's in the iliac vessel?
Any major vessels of like lower extremities or aorta, sometimes we go through these cases and you may go through many products, FFPs, fresh frozen plasmas, blood, IV fluid. So if people can go out and donate and help out, that's the most critical thing people can do.
And Dr. Siegel, you were an ER doctor for years, so you saw this firsthand. Tell us what happens when they get all of these blood supplies. Clearly, there's centrifugation or something to make sure that it's clean blood. Walk us through what happens.
First of all, Arthel, there's something called the golden hour, and it's not always an hour, but it's the amount of time you have from the time you get hit with a bullet to where you can get stabilized in an emergency room. We call it an hour. If it's an assault rifle, and this perpetrator apparently had both assault rifle and handgun, much, much, much worse with assault rifles. People usually do not survive that because the bullet fragments. Velocity is the key issue. Once it fragments, you've got to follow all the paths, and you've got things like the liver, which become damaged, the spleen, which can explode. As David was saying, the number one thing that you have to do is think about severe blood loss. In the field, once you stabilize the airway and make sure the patient is breathing, you get them to the emergency room, you try to get fluid and blood into them. Sometimes you actually have to drill down to the bone to get fluid in. If you can't get an intravenous in, you try to get blood as fast as you can. We have 5 liters of blood in our body, 5 liters total. If you lose more than 2, and that can happen very rapidly in a situation like this, you go into what's called shock. You go into shock, and then it becomes really hard to bring you back. So on the scene, you apply tourniquets, you apply compression dressings, and then if you get lucky enough to get to the hospital, get to the operating room, you don't always take the bullet out. You try to stop the bleeding.
So I think the key is the time. So time is of an essence, and usually what happens, there's about 10 to 12 people, whether they're respiratory, emergency room doctors, trauma surgeons, we're all at the booth waiting for it. We're getting calls from the paramedics in the ambulance saying that we have someone who may not have great vital signs, blood pressure is really low, we're bleeding, so we're basically calling for blood. Somebody else may have a fracture because they've been running and so they go to a different room. What happens is the entire process of the hospital shuts down. There would be no elective surgeries, there would be nobody going to the operating room. The CAT scan machines, which is usually about 2 or 3 of them, have to be freed up. And as far as the x-ray team, as far as even cleaning people, because when you get the patient out of the trauma, that room has to turn over within a minute or 2 because another patient has to go in. What's really interesting about this kind of trauma is that the entire team works like an orchestra, meaning that everybody has to work in, and usually they rip all the clothes off, they look at the entry of the bullet wound, they look at the exit. If somebody is not stable, you get the control of the airway, which is important. We intubate the patient. Operating room is ready. The surgeon goes, and the next patient comes in.
He's talking about something really important here called triaging. Somebody gets shot in the leg. you can stabilize them, but get to the people that are shot in the chest first. If their lung is down, get a chest tube in, get that lung back up. If they're shot in the abdomen, those are the people that really need emergency surgery. So the hospitals are expert at that triaging. The other factor here is psychological. And you referred to this before we came on here, that they're waiving HIPAA laws. People are coming forward with information. There's a mass gathering of people. You know, you have to be calm in these settings, and you have to be calm with any victim of a gunshot wound. That leads to a much better prognosis.
Well, I think what really happens is that all the hospitals, this is very interesting because a lot of these times, these hospitals work a little different. This is a time that there's a central communication going on between the police, with the firemen, with the triage, and all the hospitals. And once one hospital is maxed out and you can't take care of it, the overflow goes to the secondary. And this is when not only spiritually but also like the strength of American doctors and surgeons and hospitals come together to save. This is a lot of casualty. When you talk about 50 deaths, and probably the numbers are going to escalate over the next few hours, this is a lot of work. So it doesn't matter whether you're a urologist or orthopedic surgeon or a vascular surgeon, you have to be involved in doing blood drawn, transfusing, pushing the patients, and everybody will come together. That's really, really the key in a given crisis like this.
One more point is that this is Orlando Regional Medical Center, #1 in the front lines of this. They're the only #1 trauma center in the Central Florida region. That's been said again and again by you, by the reporters. That's hugely important because there's nothing they are not equipped to handle in terms of a gunshot wound.
Well, that is very good news to hear. Dr. Siegel, Dr. Samadi, thank you as always for your expertise.
Thank you.